Hello, welcome to my channel. My name is Nurse Pauline RN. I hope you're all keeping well today. Today we're going to be talking about perioperative nursing. Before we get started, please hit your like button, please hit your subscribe button, and please share my videos. Perioperative begins from the time the patient enters the doctor's office or the hospital for a procedure up until the time the patient leaves the hospital or the doctor's office. Some doctor's office, they do procedures in and out. In the hospital, you can do in and out, or you can either be admitted as an inpatient to the hospital. Perioperative nursing, we have the preoperative nurse, we have the intraoperative nurse, and we have the postoperative nurse. The preoperative nurse works closely with the surgeons, anesthesiologists, nurse anesthetists, surgical technologists, and nurse practitioners. The doctor is responsible, or the surgeon, to communicate to the patient concerning consent for the surgery, risk about the surgery, or alternatives. The nurse is only a witness. The patient signs, the guardian signs, or the families will sign the consents. The nurse will only be a witness. For a procedure, we also have living wills, and we have durable power of attorney that is used in case the patient becomes incapacitated and is not able to make decisions for him or herself. Before the procedure, we're thinking the patient is in the hospital. Before the procedure, the patient should be NPO at midnight, meaning nothing by mouth. There should be a history and physical in the chart concerning this patient. The preoperative nurse will do vital signs to make sure the patient is stable, make sure the lab values are okay. If the patient's H&H is not normal, maybe this procedure may have to be cancelled. We have to check preoperative nurse have to check to make sure the glucose level is okay. If the glucose level is not okay, the preoperative nurse will communicate to the doctor and they will order some dextrose 50 for this patient. The preoperative nurse will check the patient's ABCs, make sure the patient is fine for the surgery, make sure the patient has an allergy bracelet on. If patients were on aspirin or Plavix or heparin, these should have been discontinued, but if it was not discontinued before the surgery, the preoperative nurse should communicate that the patient is still on aspirin, Plavix, any blood thinner. The doctor should be aware of this if the patient is going to surgery. If the patient is allergic to codeine, the surgical team should be aware of this. Patients should all have their allergy bracelets on. Women, the doctor may have ordered pregnancy tests for some ladies. If pregnancy test is ordered, the preoperative nurse should make sure there is a result in the chart concerning this patient. The patient who is going to surgery will wear a hospital gown, not street clothing. All hairpins, jewelries, braziers, the patient cannot go to surgery with those. the patient cannot go to surgery with contact lenses, hearing aids, dentures. Those should all be removed. The nurse should make sure a pre-operative checklist is completed for the surgery. All personal belongings for the surgery should remain in the patient's room. Patients should void before procedure. All patients need their bladders to be emptied before the procedure. The doctor usually ordered an EKG. If an EKG is ordered, an EKG results should be in the patient's chart. Patients going to the OR, we should consider their cultural and spiritual practices and beliefs concerning shaving. Some cultures do not shave their beards. There could be an order for pre-operative medications to be ordered before patients going to the OR. Sometimes these are IV antibiotics. Make sure your patients are NPO, have not drank or ate anything throughout the night. We can offer them mouth swabs to freshen their mouth, but they do not swallow the water. They can brush their teeth, but do not swallow their water. The pre-operative nurse should order teaching to their patients. Teach patients how to use the incentive parameters. The pre-operative nurse teach about pain management. Some patients may have to use a PCA, which is a patient control analgesic. They'll just press that button after surgery. The pre-op nurse addresses the patients and families concerning the surgery, address all their concern, use therapeutic communication. For all patients going, there should be a psychological and physical assessment of all patients going to surgery. We have the intraoperative nurse. Intraoperative begins when the patients enter the surgical area to the OR, transferred to the OR bed, to the care of the surgeons, anesthesiologists, the scrub nurse, the circulating nurse who are in the OR itself. When patients are in the OR, the intraoperative nurse will do scrubbing and gowning and gloving. The scrub nurse will set up tools and make sure there is a sterile feel. This intraoperative nurse will assist the surgical team by donning sterile masks and gloves and gowns, as well as assisting the surgeons to pass out instruments during surgery. In surgery, we have surgical hand washing. Fingers and hands should be scrubbed first with progression of forearms and elbows. Hands held away from surgical attire. Hands higher than elbows at all times prevents contamination. The circulating nurse works inside the OR as the patient's advocate. The circulating nurse ensures that operative procedure have patient's interest in hand. The circulating nurse performs duties outside of the sterile field. The intraoperative nurses will assist the anesthesiologists with anesthesia, with administration of anesthesia. The intraoperative nurse assist in positioning the patient, assist with skin prep for incision. The intraoperative nurse coordinates the patient's care before surgery, during surgery, and after surgery. The intraoperative nurse provides emotional support for patient and family. The intraoperative nurse provides safety, privacy, dignity for the patient. The intraoperative nurse continues assessment of the patients throughout. The intraoperative nurse initiates time out between entire surgical team before surgery. Time out verifies 1. Correct procedure. 2. Correct patients. Use the ID bracelet. 3. At the correct site. Intraoperative RNs provide a lot of warm blankets for patients after surgery, preventing hypothermia. After surgeries, patients are very cold, and there are warm blankets in a warmer that the nurses use to cover the patients after surgery, which prevents them from shivering. After the surgery, the patient is transferred from the intraoperative nurse to the post-operative nurse. This area is called PACU. This is your post-anesthesia recovery unit nurse. The post-anesthesia nurse, PACU nurse, post-operative nurse, she assesses the patients with frequent vital signs. She assesses the oxygenation of our patients. She assesses our patient for periods of apnea. She does cardiac monitoring, neurologic assessment, musculoskeletal assessment. She assesses the lower level of consciousness of her patients. She assesses patients for respiratory depression. She assesses patients' pain. By then, a PCA would have been set up for these patients. More like a PCA is a drip. It's a patient analgesic pump that the patient uses. It's self-controlled by our patients. She will be assessing respiratory depression. The PACU nurse, the post-anesthesia nurse, she assesses your patient's urine output after surgery. We are assessing that urine output will be greater than 30 cc's an hour. She's assessing the patients for deep breathing. She'll teach them how to use the incentive spirometer. She's assessing patients for atelectasis, pneumonia, pulmonary embolus. She assesses the incision sites. In assessing for hemorrhages, patient is NPO as ordered by the doctor. She is assessing patients for nausea and vomiting post-operative, and she's giving them anti-nausea medication. The post-operative PACU nurse is assessing patients' fluid and electrolyte balances. She's administer additional IV fluids if the patient needs it, potassium runs, magnesium runs, blood transfusion for patients who had lost a lot of blood after surgery. We are assessing the blood loss in surgery, and we're checking the patient's H&H, and blood transfusion is done by the PACU nurse. The PACU nurse is assessing complications that would require the patient to be returned to surgery. The PACU nurse is assessing hyperthermia and hypothermia. Hyperthermia for temperature 103. Patients are at risk for sepsis. The PACU nurse is applying embolism stockings to patients, preventing thrombophlebitis. The PACU nurse is giving reports to the floor nurses. Some patients will be going home if they had in and out surgeries, if they are going to be admitted to the med-surg floors or ICU or cardiac step-down monitoring floors. The PACU nurse will be giving report to the floor nurse who are receiving the patients from the OR. The PACU nurse will be faxing report to the floor nurses. The PACU nurses will be coming up to the floor personnel to give a face-to-face handoff of patients. When patients get to the floor, the OR patients are delegated to the registered nurse, not the LPNs, not the techs.